Called as what is that? Glycogen. Called as what is that? Glycogen, for example. If I break the glycogen, I will get multiple molecules of glucose, right? Multiple molecules of glucose. So if I break glucose, I will get what is that, sir? All of you tell me pyruvate, right? So if I break glucose, I'm getting pyruvate, but pyruvate is not a, yes, pyruvate is not a carbohydrate. So if at all anything which cannot be further, it is not a carbohydrate, pyruvate. So if at all any sugar which cannot be hydrolyzed further into what? Into your carbohydrate, we will call it as monosaccharide. So monosaccharide combines together to form the multiple complex carbohydrate. All the carbohydrates made out of what is that? Monomers of the carbohydrate. So that is only what is that? Monomers of the carbohydrate which cannot be hydrolyzed further. The examples are important. Can you tell me some examples, Bacho? Come on quickly. Can you tell me some examples for the monosaccharides? Very good. Glucose, fructose. Very good. All of you are correct. Galactose. Glucose, fructose, galactose. So glucose, fructose, and your what is that? Galactose. So these are the substances which are working as a monosaccharides. Then we have disaccharides. Disaccharides means when I break this carbohydrate, I will get two newer carbohydrate. If I'm getting two new carbohydrate, then I will call it as a disaccharide. So 2 to 9 monosaccharides if they are there, then we will call it as what is that? Oligosaccharide. We call it as oligosaccharide. We call it as oligosaccharide. Up to 9 sugars. If more than 10 is there, then we will call it as a polysaccharide. So all of you should remember polysaccharides are the very important MCQ because they'll ask you the classification and diseases related to it. Okay. So whenever you are speaking of a polysaccharide, which is a polysaccharide, all the polysaccharides can be divided into monoglycan, heteroglycan, and homoglycan. What is a homoglycan? What is a heteroglycan? Now look here, homoglycan is any substance made out of, see, it is a polysaccharide. Polysaccharide is made out of more than 10, what is that? 10 or more than 10 monosaccharide. So if all the monosaccharides which are present, if they are the same, then we will call it as a homoglycan. What do I mean by this? For example, if you look into the glycogen, it is only made out of only one substance, that is lots of glucose. So if it has a lot and lots of glucose, so it is made out of a similar sugar, then I will call it as a homoglycan. The classic example which is present in the body is your glycogen, sir. Then we have heteroglycan. Heteroglycan is what? Heteroglycan is nothing but it is made out of different monosaccharide. It's not the same monosaccharide. We call it as a, then we'll call it as what is that? Heteroglycan. What is that? Heteroglycan. So we have classic example. One is glycosaminoglycan and another one is your cellulose. So glycosaminoglycan is also called as mucopolysaccharides, which is mucopolysaccharide are also called as what is that? GAG. GAG stands for glycosaminoglycan. So please understand we have some glycosaminoglycan and other diseases. So glycosaminoglycans are metabolized in where? Yes, come on, tell me, metabolized by your lysosomes. What is that? Lysosomes. Okay. So if there is a defect, sir, if there is a defect, it will give rise to which disease? Defect. If it is a defect metabolized by the lysosome, if there is a defect to this, what disease will rise, sir? Anybody? Come on quickly. So it is called as mucopolysaccharidosis. Mucopolysaccharidosis means glycosaminoglycans will start to accumulate in the cell, leading to Hunter and Hurler disease. What is that? Hurler disease. Okay. Hunter disease and Hurler disease. So Hunter and Hurler disease are due to deposition of which substance? That is your, of course, glycosaminoglycans, which has been previously, which has been previously asked also. And they'll ask you very simple. If they'll give a lot of complaints and in the cells, they're found to have a deposition of glycosaminoglycan. What will they tell? They will tell that they'll give a non-specific clinical feature, and in the biopsy of the cell, they found mucopolysaccharides, excessive deposition of the mucopolysaccharides. If they tell you, that is a suggestive of Hunter and Hurler disease. Okay. Now let's talk about the glycosaminoglycans, the classic examples for the glycosaminoglycans. So what are the classic examples we have glycosaminoglycans, sir? We have a hyaluronic acid. Hyaluronic acid is present where? Can anybody tell me quickly? Come on. Hyaluronic acid is present where? Everyone should tell. There are 145 students. I'm getting only one or two responses. No. I want you everyone to tell me. Come on. Active होना चाहिए मेरा class में, हाँ? It is present in the synovial joint. Bone nahi hai, confuse mat hoइएगा please. Very good. It is present in the synovial fluid बच्चों. What is that? Synovial fluid. Synovial fluid. Okay. ये bone को क्या करता है? What does it do to the bone? Bone कहना पढ़नो. What does it do to the bone? Very good. It delays the bone healing. Very good. Delay the bone healing. Delay the bone healing. So they can ask you a question based on this. Based on this. A 55-year-old female. Now listen to me. Listen to me. The question how it will come. If you want, you can write it down. So they will give you a 55-year-old female had a fracture. Had a fracture of neck of the femur. Had a fracture of neck of the femur, in which she developed non-union of the bone. Non-union of the bone. So this non-union of the bone is caused due to what? Our prevention of healing is done due to what? It prevents from healing is due to hyaluronic acid. Hyaluronic acid. Now even remember, hyaluronic acid is given for a patient. Which disease patient में देते हैं? Hyaluronic acid supplementation. Which disease we will give? सर हम तो भूल गए, है ना? We forgot. Very good, very good. You people are absolutely correct. It is given as a C in the osteoarthritis. Osteoarthritis is a disease in which what happens, as I have earlier told you people, there will be, yes, osteoarthritis patient will have a decrease of synovial fluid given as a supplement, given to patients with osteoarthritis. Osteoarthritis is seen with obese people. It usually starts with the large joints, especially in the knee joint. Okay. Chondroitin sulfate. Chondroitin sulfate कहाँ से मिलता है? Where do you get the chondroitin sulfate from? It is found in which part? Yes, of course, if people were correct. That is found in the cartilages. Found in the cartilages. Very nice. Then we have keratin sulfate. So keratin sulfate के अंदर दो तरीके होता है. There are two types of keratin. Let's just quickly recall that. What is that? Very good. That is your hard and soft. Very good. Hard and soft. So hard keratin and soft keratin. So soft keratin is found in hair. Okay. That is hard one is found in the nails. Okay. Sir, what is the difference between the ये hard है कि soft है? हमें कैसा पता लगेगा? Why it becomes hard? अरे, I am talking about keratin. Okay. Why keratin becomes hard? Yes, which bond? That is your number of disulfide bond. Okay. Very good. Hard keratin consists of more number of, yes, more number of disulfide bond. Very good, bachcho. Okay, more number of disulfide bond, because of that hard keratin is formed. Okay, let's continue to the next one. That is your heparin. Heparin comes from which cell, and mechanism of action of heparin also is important. So heparin actually, my dear students, heparin comes from your mast cells. Comes from which cell? Mast cells. Okay. Now this heparin, what is the function of heparin? Can anybody tell me function of heparin? So this is a type of anticoagulant. It's a type of anticoagulant. Okay. It's a type of anticoagulant. Anticoagulant of which type? It is both direct and indirect anticoagulant. It is both direct and indirect anticoagulant. So that is a point which you need to remember. Okay. All right. Let's continue. Let's continue. So once we understood about the glycosaminoglycans, let's get into the important next chapter. That is the next important concept called as dietary fibers. So dietary fibers are such type of carbohydrate. They are not digested, not absorbed by the body. They are not digested in the body. They are not absorbed in the body. So what are they? They're just they're present in the food, and from the food they will go into the intestine. In the intestine they don't break down. They don't get damaged. They don't get absorbed. They just get excreted. But while they're going, it will help our body to reduce the risk of colon cancer. They reduce the risk of colon cancer, and also they increase the bulk of the stool. Increase the bulk of the stool. If you increase the bulk of the stool, easy defecation or difficult defecation? Easy defecation. That means we can prevent the constipation. We can prevent what is that? Constipation, because of by using which drugs, by using which substances? Dietary fiber. So dietary fiber के बारे में question आया था earlier. The question was asked. So which of the following is the role of dietary fiber? The role of dietary fiber is what? Reduce the risk of colon cancer. Okay, this is a very important point to be remembered. It reduces the constipation and also reduce the risk of colon cancer. Let's talk about the glucose transporter, my dear students. This is a very important concept. Once again, it has been many times asked. So what is this glucose transporter? So glucose transporter, my dear students, it is a type of passive diffusion or active transport. It's a type of primary active transport. Primary active transport. So it is a, sorry, it's not a primary active, sorry. It's not active transport. It is a facilitated diffusion. It is a facilitated diffusion. It is a facilitated diffusion, not active transport. I'm really sorry. It is a facilitated diffusion. It is a facilitated diffusion. Very good. It's a facilitated diffusion in which it is a single direction or bidirection. Single direction means, for example, you consider there is one cell. Okay, we have a glucose transporter which is sitting here. So this glucose transporter allow the entry of the glucose also. And glucose transporter will allow the exit of the glucose also. They are bidirectional, my dear students. There you are. Bidirectional. What is that? Bidirectional. So these are your bidirectional in nature. So this is a very important point to be remembered. Okay. Then we have, it's a bidirectional. They work by a mechanism called as ping pong mechanism. Okay. So sir, again you are writing the whole notes here. No, I'm trying to recall that information. So what you are supposed to do? The trick you need to understand. Trick, very important. What is the trick is, you need to I want you to recall the whole notes. While doing that recall of the whole notes, I want you to focus on the highlighted points which is written here, जो exam के अंदर question बन सकते हैं. Okay, I want you to pay your attention towards what? I want you to pay your attention what is written here, because they can become a exact questions in your exam. So that is the point which I'm trying to tell you. Okay, one second guys. One sec. Yeah, let's continue. So they work by a ping pong mechanism. So ping pong mechanism. I want you to focus. You understood, I hope. So GLUT1, my dear student, glucose transporter 1. It is located in, everybody should repeat with me here. Okay. Since it is not an offline class, I want you to repeat. GLUT1 is located in your red blood cell, brain, placenta. They are active even during hypoglycemia. My question now is, do they depend upon insulin for its action, or they don't depend? They're insulin dependent or insulin independent? Very good. They are insulin not dependent. That is independent of insulin. Okay. Insulin independent. Okay. Insulin independent. So they do not require insulin for their action. Okay. So this is a point to be remembered. And next important, GLUT1, my dear students. GLUT1 is located also, it is also found on tumors. It is also found on tumors. It is also found on the tumors. So malignant tumors will have, what is that? Glucose transporter 1. So because of this glucose transporter 1 being on the malignant tumor, we can use, what is that? 18-FDG. So they're present in the tumor. Isliye we use, what is that? 18-FDG. Previously they have asked the full form of FDG also. Repeat that with me. Fluorodeoxyglucose. What is that? Fluorodeoxyglucose, which is used for the investigating of malignant tumors which has metastasized with the help of a scan called as a PET scan, sir. What is that scan, sir? PET scan. What is that scan? PET scan. They're used in the PET scan. Which one? Which one? 18-FDG. They're taken up by which one? Glucose transporter 1. Even if your blood glucose level is 45, they can tell you. They can tell you a complex question like this. Okay. So I'll explain the question on what they can play with you. Okay. A 45-year male, unconscious, a 45-year male, unconscious, found to have blood glucose level of 65 mg per deciliter, Which of the following, which is still active? Which of the following is still active? Options de dega. Options will be option A, GLUT4, option B, GLUT2, option C, GLUT3, option D, GLUT1. Okay, so what will be your answer? Answer will be your GLUT1, my dear students. Okay, that will be your GLUT4 or GLUT4. Sorry, which one? What is the answer? Option A, B, C, D. Which GLUT is active? Remember, GLUT4 is not active in hypoglycemia. The one which is active in hypoglycemia is which one? D, bacho. What is that? D. Answer D is the correct answer. That is GLUT1. Answer is GLUT1. Very good. Okay. So GLUT stands for glucose transporter. GLUT2 is located in the liver and pancreas. In the pancreatic beta cell, it causes the release of insulin. Release the insulin. So from the pancreas, release of insulin from the pancreatic beta cells, release of insulin takes place with the help of which glucose transporter? GLUT2. Okay. So do not get confused. Insulin dependent means what? For their action, they need insulin. Okay, so that will be GLUT4. That is not GLUT2. GLUT2 causes the release of insulin. GLUT2 causes the release of insulin. So it is not a insulin dependent. It is a insulin independent. It is dependent on the blood glucose level. So if your blood glucose level increases, but that more glucose will enter into the pancreatic beta cell. In more glucose entering into the pancreatic beta cell, which will cause the release of your, what is that? Yes, sir, release of your the release of your insulin. GLUT3 is located in the neurons and brain. GLUT4 is found in adipose tissue, muscles and heart. GLUT4 require insulin for its action. GLUT4 require insulin for its action. Okay, so don't get confused. Whatever the insulin which is released as a result of activation of glucose transporter 2, that insulin will go and act on the adipose tissue, skeletal muscle and heart. That will make the action of GLUT4. So if GLUT4 should function, we need, what is that? Insulin. But GLUT2 will cause the release of, but GLUT2 will cause the release of insulin while it requires the insulin for action. That will be your GLUT4. And this was a previously asked question. Repeat with me. What is that? Where it is located? Found in adipose tissue. Repeat with me where it is found. 3 locations. Come on, everybody, repeat there. Adipose tissue. Very good. Muscles and heart. These are the 3 locations. What is located? Your GLUT4 is located. GLUT5 कहाँ पे होता है sir? GLUT5. GLUT5, yes, GLUT5 is located in the intestine. GLUT5 is located in the intestine. It absorbs the fructose. It absorbs the fructose. It absorbs what? Fructose. Absorb what? Fructose. Okay, small intestine. Very good. Okay, GLUT4 can also be found in liver also. Yes, it will be there. But main 3 locations I want you to remember: adipose tissue, muscles, heart, and one more location is of course your liver. Okay, of course liver has GLUT4. Okay, now let's go to the next one. GLUT5 is located in the sperm also. It is located in the sperm also. So in the sperm, the motility of the sperm comes from where? Fructose. Fructose gives the energy by taking up your fructose, which is through the help of your, what is that? With the help of your of course your GLUT5. Okay, so let's talk about the next important. So 1 second guys, I need to change the setting, I think. So all right, done. Let's continue here. So GLUT4 is located where? GLUT4 is located in the adipose tissue, liver, muscles. Adipose tissue, liver, muscles, and your heart. Okay. Now let's go to the next one. Secondary active transport, called as, what is that? So that is secondary transport. That is your sodium glucose transporter, which means sodium glucose transporter. Will it work alone individually, or it require always sodium and glucose, both of them for its function? It requires, of course, it requires sodium and also it requires your glucose. Very good. It requires both sodium and glucose. That is why we will call it as a SGLT. That is your sodium glucose transporter. That is your sodium glucose transporter. Sodium glucose transporter. Okay. So SGLT. So SGLT. This SGLT is located in the small intestine. That is your sodium glucose transporter. Your whatever the ORS you drink, for example, ORS will undergo rapid absorption because of it consists of both sodium and glucose. That sodium and glucose will be absorbed from the intestine. That is your small intestine via SGLT1. SGLT1 sodium glucose glucose transporter 1. Then SGLT2 is located where? In the proximal convoluted tubule of the kidney, in the PCT of the kidney, PCT of the kidney. So if at all PCT of the kidney, what is the function? It will reabsorb the sodium and glucose. Reabsorb sodium and glucose in from where? Sodium and glucose from your kidney, from your kidney, proximal convoluted epithelium. Okay, so please remember, proximal convoluted tubules epithelium consists of your SGLT2. If you block the SGLT2, what will happen to glucose? Now glucose will get reabsorbed, or glucose will go into the urine. If you block SGLT2, if you block which one? SGLT2. If you block which one? SGLT2. So if you block SGLT2, what will happen? Of course, there will be loss of, what is that? There will be loss of your, yes, sodium and glucose. Okay, sodium and glucose. Okay. So if there is a loss of sodium and glucose, if there is a loss of sodium and glucose, which decreases the blood glucose, इसलिए we use SGLT2 blockers in the treatment of diabetes mellitus. SGLT2 blockers are used because of this SGLT which is located in the proximal convoluted tubule. Now, one important point, SGLT2 blockers, now they are approved for the treatment of course, cardiac failure also. SGLT2 blockers are approved for cardiac failure also. What is the side effect caused by SGLT2 blocker? SGLT2 blocker will cause the recurrent urinary tract infection. Very good, dear students. You are absolutely correct. That will be your side effect. Okay. Let's go to the next concept, hypoxia. Hypoxia is a very, very important point to be remembered. Hypoxia is nothing but what is that? There is a lack of O2, lack of O2. So lack of O2 can occur because of multiple reasons. Based on the cause, we have multiple reasons for hypoxia. The first type of hypoxia is your hypoxic hypoxia. Hypoxic hypoxia, when it will occur. So let me just let me just go a little bit deeper into the chapter of hypoxia. So 1 second, let me take a new page. Let me just quickly explain the hypoxia chapter for everyone, because this has become a very important thing which is frequently asked also. I don't want any of my students to lose it out. So if at all if you have missed the, if you have forgotten, if at all any such thing has happened, now is a very good chance for you to learn hypoxia. Just quickly listen to me. First one is called as hypoxic hypoxia. Hypoxia. What is hypoxia, my dear students? It's very simple thing to understand. So, for example, when you go to a high altitude, dear students, when there is a high altitude, okay, so when there is a high altitude, automatically what will happen? There is a decrease of partial pressure of oxygen. There is a decrease of partial pressure of oxygen. So means in the atmosphere, oxygen pressure has gone down. Because of that, there is a lack of O2 supply. Lack of O2 supply. If there is a lack of O2 supply, what will happen? Leads to hypoxia. Here the respiratory system, lungs are fine, hemoglobin is fine, and your tissues are fine. Everything is normal. Only thing is that partial pressure of oxygen is reduced. Because of that decrease of partial pressure of oxygen, that will lead to increase of respiratory rate. If there is an increase of respiratory rate, automatically what will happen? Increased respiratory rate that will lead to what? Loss of CO2, because you're doing this. So every time you're breathing, you are sending whom out? Yes, you are sending whom out? That is carbon dioxide. Loss of CO2. Loss of CO2 will lead to what? Respiratory alkalosis. Because of the respiratory alkalosis, what will happen? The patient will have symptoms such as dizziness. Okay, then patient can have headache. Okay, so these are a suggestive of what is that? These are suggestive of mountain sickness. These are suggestive of mountain sickness. These are suggestive of mountain sickness. Okay, high altitude, low partial pressure of oxygen. Because of that, hypoxic hypoxia. That part is done. They can lead to one more sickness, mountain sickness. Mountain sickness का drug of choice बताइए भाई. बहुत बार गलती कर रहे हो. Many students are making the mistake. I have noticed from many students are making this mistake. By mistake they are marking wrong answer, so please don't mark the wrong answer. The answer is acetazolamide. The answer is acetazolamide. Scopolamine is for motion sickness. Scopolamine is for motion sickness, not for mountain sickness. For the mountain sickness, acetazolamide. Acetazolamide is the drug of choice, which is a carbonic anhydrase inhibitor. The next question, what can be asked for you people in collaboration with biochemistry, physiology, and pharmacology? Why acetazolamide is used? Why it is used? This is the next possible question if they ask you about mountain sickness. If they ask you mountain sickness, the next possible question is this only. Why it is used? Why? Tell me. Any guesses? Any guesses why it is used? Remember, many of us think one reason, because sir, it will cause the loss of bicarbonate. If bicarbonate is lost, body will become acidic. Here alkalosis is there. That is why we are causing the acidosis to happen using acetazolamide. No, it is not because of that. So yes, loss of CO2, what it will do? Yes, it will inhibit the carbonic anhydrase in the lungs. Carbonic anhydrase in the lungs. So because of inhibition of carbonic anhydrase in the lungs, that will lead to what is that? Prevent the loss of CO2. That will prevent the loss of CO2. Prevent the loss of CO2 from where? From the lung. From the lung. That is the reason why we use which one? Carbonic anhydrase inhibitor. Carbonic anhydrase inhibitors are also used in the treatment of glaucoma, such as brinzolamide and dorzolamide. So these are the important point related to your hypoxic hypoxia, mountain sickness, and your what is that? That is your increase of respiratory rate. Okay. So now let's go to the next type of hypoxia. Next type of hypoxia, what is that? Let's talk about the anemic hypoxia. Let's talk about the anemic hypoxia. Anemic hypoxia. Now, anemic hypoxia, sir, very simple. So here, respiratory system normal. Okay. Now here, what is that? Partial pressure of oxygen normal. Okay, everything is normal, but there is a decrease of free hemoglobin. Decrease of free hemoglobin. So whenever there is a decrease of free hemoglobin, so hemoglobin is not free. Hemoglobin, if it is not free, there is nobody is there to transport the oxygen. So decrease of free hemoglobin, that will lead to decrease O2 supply. Decrease O2 supply, that is only your what is that? Anemic hypoxia. Now when we are speaking of anemic hypoxia, what are the causes? The first cause is anemia itself. First cause is anemia itself. So because of this anemia patient, directly remember, anemia patient has no cyanosis. Cyanosis may not be seen in anemia people. Cyanosis may not be seen in anemia people. The next one is that anemia, and one more is there. Who is that one more? Come on, tell me one more cause for anemic hypoxia. Anemic hypoxia's cause, we have discussed this in the classroom, but everybody should tell me. Everybody should tell me what is that. Very good. The answer is your, yes, carbon monoxide poisoning. What is that? Carbon monoxide poisoning. Okay, carbon monoxide poisoning. So carbon monoxide poisoning, what happens? So normally hemoglobin and oxygen are happily living together. Happily living together. Now, any two things happily living together, what can happen? Of course, there can be a somebody called as third wheel. Okay, so bestie will enter into the scenario. What is that scenario? Carbon monoxide will enter into the scenario. That is only best friend. Now, hemoglobin slowly will get attracted towards the best friend. Okay, so now what will happen? Carbon monoxide carbon monoxide bind strongly with the hemoglobin, and now oxygen is looking at the hemoglobin. Arey bhai, mera halat kya ho gaya? What happened to me? It is looking at like this. Okay, it is looking at like this. So now what happened is carbon monoxide poisoning has occurred. Carbon monoxide poisoning, hemoglobin is there, but free hemoglobin is not there, dear students. Remember what is not there? Free hemoglobin is not there. So that is the reason behind your, what is that? Reason behind the carbon monoxide poisoning. So that time what we need to do? We need to torture them. So this complex carbon monoxide and hemoglobin are together, right? Now we need to make them separate. We need to torture them so much that hemoglobin itself should leave the carbon monoxide, come and bind with the oxygen. What, how to do that? How to do that is by giving a hyperbaric oxygen, hyperbaric oxygen, hyperbaric oxygen. High pressured oxygen is given for, what is that? For your, what is the treatment of carbon monoxide poisoning. So this is a very important concept which all of this has been written. अभी मुझे ये मत, now don't tell me that सर हम लिख लेंगे सर 2 मिनट में लिख लेंगे नोट्स. लिखो मत सर, जरूरत नहीं है, ऑलरेडी हमारे पास लिखा हुआ है. We have the written notes already, you don't have to write it down. Anyways, sir. Now, once we understood about the carbon monoxide poisoning and anemic hypoxia, then let's go to the next one, that is ischemic hypoxia. Ischemic hypoxia are also called as stagnant hypoxia. Okay, what is stagnant hypoxia? Because of, so here partial pressure of oxygen is normal, PO2, respiratory system, hemoglobin, all of them are normal, sir. Only problem is what? Problem is with the blood flow. So there is a lack of blood supply due to, there is a lack of blood supply. There is a decrease of blood supply. There is a decrease of blood supply. So because of the decrease of blood supply, leading to what? Hypoxia. Leading to what? Hypoxia. Okay. Problem is with the flow. Yes, of course. If the problem is with the flow, then how to solve the problem? How to find out the problem? It is associated with which diseases? Vascular diseases. Vascular diseases such as atherosclerosis. Okay, that is a story of your, what is that? That is your ischemic hypoxia. Then the last but not the least, what is that? Yes, of course, that is your, what is that? Tissue hypoxia. Tissue hypoxia. Tissue hypoxia. Tissue hypoxia are also called as, what is that? It is also called as histotoxic hypoxia. What is that? Histotoxic hypoxia. So in the histotoxic hypoxia, basically what we are doing, sir, what we are doing is that we are inhibiting the tissue respiration. We are inhibiting the tissue respiration. Okay, how does oxygen is utilized in the tissues? In the tissues, oxygen is utilized for the energy synthesis by your what? By your electron transport chain. Electron transport chain. So the tissues are utilizing what? Electron transport chain. Okay, so electron transport chain is utilizing the oxygen in the tissues. So basically, tissue hypoxia inhibits electron transport chain. That is due to, of course, cyanide poisoning which can occur, and even carbon monoxide. Carbon monoxide causes both the type of hypoxia, tissue hypoxia and also your, yes, your anemic hypoxia. Okay, so that is the story of hypoxia, which is a very, very important point to be remembered. Let's continue, dear students, here. So what is that? Hypoxic hypoxia. Okay, anemic hypoxia, then ischemic hypoxia is with the flow, and historic, it's not historic, histotoxic. Okay, histotoxic hypoxia because of blockade of electron transport chain such as cyanide poisoning, and even carbon monoxide poisoning also does that. Okay, let's continue to the next important concept. What is that? My dear students, let's discuss about the electron transport chain itself. Okay, now whenever you eat a carbohydrate, let me just give you a quick outcome. Any carbohydrate you eat, for example, let's take glucose only. Now glucose comes into the body, it will get converted into pyruvate. It will get converted into pyruvate. This process we call it as glycolysis. We'll call it as a glycolysis. So after the glycolysis, pyruvate gets converted into acetyl-CoA. Acetyl-CoA. Acetyl-CoA enters into which cycle? Enters into Krebs cycle. Enters into Krebs cycle. So in both the cycle, glycolysis and Krebs cycle, glycolysis also gives hydrogen and Krebs cycle also gives a hydrogen. All this hydrogen will be taken up by who is that? Hydrogen acceptors. Hydrogen acceptors. What are the hydrogen acceptors we have? Come on, quickly tell me hydrogen acceptors in the body which we are present. There are two hydrogen acceptors. Everyone should tell me. Very good. NADH and FADH. Very good. What is that? NADH. Yes, NADH and FADH. So this NADH and FADH enters into the electron transport chain. Enters into the electron transport chain. Once they enter into the electron transport chain utilizes this hydrogen and gives us the energy. Gives us the energy. So ATP. So this is the fate. Any carbohydrate comes into the body, glucose to pyruvate called as glycolysis. From the glycolysis, we'll have acetyl CoA. Acetyl CoA will have what is that? Acetyl CoA from their Krebs cycle. From all these cycles, we will have hydrogen acceptor enters into electron transport chain for the energy production. So let's discuss about the electron transport chain. What are the important questions and what is electron transport chain? So my dear students, just all of you already know this theory. Just quickly I'm recalling that. So here I have a mitochondria. In the mitochondria, I'm taking one small section and drawing it here. So I have an outer membrane and an inner mitochondrial membrane. So inside the inner mitochondrial membrane, what we have is matrix. So that is only called as inner mitochondrial matrix. Okay, so all the mitochondria is located where? In the cytoplasm of the cell. So outside of the mitochondria, who will be there? Cytoplasm. Inside of the mitochondria, what will be there? Matrix will be there. So in the inner membrane, in the inner mitochondrial membrane, we have two important things. One is complexes. But what is that? Complex. Complexes are there. Complexes are there on the inner membrane. And one more will be there, my dear students, called as transporters. What is that? Transporters. Okay. Now, what are these complexes? Basically, complex means I'm referring to a enzyme. So, enzymes are only what is that? Your complexes. Enzymes are only your what is that? Complexes. So, the first enzyme or a first complex, what it will do? Okay. It will utilize the NADH and form the hydrogen and electron. So NADH is utilized. NADH is utilized. So basically complex one is called as NADH dehydrogenase. NADH dehydrogenase. Dehydrogenase. NADH dehydrogenase does what? It converts your NADH into what is that? NAD electrons and hydrogen. What are coming there? Electrons, hydrogen. Okay. So this enzyme NADH dehydrogenase forms the hydrogen. This hydrogen will enter into the, where will it enter? Into the intermitochondrial space. Intermitochondrial space. Whatever the electrons which are generated, these electrons are given to something called coenzyme Q. What is the other name for coenzyme Q? Everybody come and tell me what is the other name for coenzyme Q? Very important name called as ubiquinone. Ubiquinone, not ubiquitin, ubiquinone. Ubiquitin is different. It comes in the chapter of proteins. Ubiquinone is the transporter. It takes all the electrons from the complex number 1. Okay. Then we have second complex. It utilizes FADH, forms the hydrogen and electrons, and these electrons are also given to what is that? Coenzyme Q. So from the complex 1 and complex 2, all the electrons are given to ubiquinone and all the hydrogen will be pumped where? Pumped into your what is that? Intermembrane space. Okay. From there, all the electrons will go into the complex 3. Complex 3. From there, it will enter into what is that? Cytochrome C. What is this cytochrome C? Cytochrome C is a type of transporter. So complexes are numbered 1, 2, 3, 4 and fifth complex. So these between they are called as a transporter. So we have cytochrome C. Cytochrome C also takes all the electrons and goes and give it to complex number 4. So complex 4 utilizes these electrons and utilizes the oxygen from the breathing and undergoes one reaction called as oxidation. While oxidation is occurring, all the hydrogen which was pumped out into the intermembrane space, it will utilize all the hydrogen. While it utilizes the hydrogen, it causes conversion of ADP into ATP. So this reaction is called as phosphorylation. What is that? Phosphorylation. Now, can oxidation occur without phosphorylation or Can it occur individually or it should occur together? In a normal individual, tell me, oxidation and your what is that phosphorylation, what should happen to the oxidation and phosphorylation? Should happen separately or together? They should always occur together. When oxidation and phosphorylation occurs together, we will get what is that energy, that is energy, ATP. They should not be separated. So what is there? Oxidative phosphorylation will be there. So the important point which you need to understand by looking at the image itself, you can tell, can you answer me this? Which complex does not interact with the intermembrane space? Which complex does not interact with the intermembrane space? Come on, tell me. Can you tell me which one does not interact with the intermembrane space? Everybody should tell me. Complex number 2. Very good. Complex number 2. This is a previously asked question. Which complex in the electron transport chain does not interact with the intermembrane space? Intermembrane space. Very important point. Okay. Now listen to me very carefully, sir. So these are a coupled reaction. So if it is a coupled reaction, automatically there is a possible for uncoupling. So there are uncouplers. Anything together, any two people are together happily means there will be somebody who will be there to separate. कोई ना कोई होगा अलग करने के लिए, ठीक है? फिर చూడడానికి ಯಾರಾச்சும் ಇರುಪಾಂಗ. Okay, so there will be some uncoupler. So there are some uncouplers. They'll ask you as a examples. What are those uncouplers? They are only called as 2,4 dinitrophenol. Okay, then we have aspirin. Then hormones such as thyroid hormone and thermogenin. Thermogenin is present in the brown fats of the brown fat, which is present in the brown fat. Okay, so because of uncoupling, uncouple the oxidative phosphorylation. So if uncouple the oxidative phosphorylation, the question I'm having for you people, will energy generate? Yes or no? First thing, will energy generation be takes place? Will the energy ATP synthesis take place if they are separated? There is no ATP synthesis. If there is no ATP synthesis, only what will be generated is heat. No ATP, no ATP production, but only heat production. But only heat production. Okay, heat production. So this is a very important question to be remembered. Increase the body temperature. That is why, bachcho, if you have finished this one, what is that? Hyperthyroidism chapter. What are the clinical features of hyperthyroidism? Patient will have loss of weight, increase of body temperature. The increase of body temperature point, you need to think about this. Hyperthyroidism, one of the reason for increase of body temperature is your uncoupling of reaction, uncoupling of this reaction. Okay, inhibitors of electron transport chain. So this is a very, very important question which has been very frequently asked, because one or the other directly questions will be asked. Okay, so they will ask, so what exactly is there? So they have the important point. What is that called as? That is uncouplers of electron transport chain. So what is that uncouplers? So we have inhibitors of electron transport chain. So electron transport chain consists of complexes. All the complexes are what? Basically enzyme. If there is an enzyme, there can be an enzyme inhibitor. Okay, so barbiturates and rotenol, inhibits which complex? Complex number 1. Barbiturates and rotenol inhibits which complex? Complex number 1. Which barbiturate very famously given in the exam? In the exam very famously given is amebarbital. What is that? Amebarbital. Okay, it's not Amy Barbie doll, it's amebarbital. Okay, amebarbital. It's not Amy Barbie doll. Okay, so it's a amebarbital, that is your complex 1 inhibitor. We have a chemical called as malonate. Repeat with me. What are the first complex 1 inhibitor? Complex 1 inhibitor. Repeat them with me. Complex 1 inhibitor. Yes, rotenone barbiturate. Repeat again. Complex 1 inhibitor, rotenone barbiturates. Repeat once again. Complex 1 inhibitor, rotenone barbiturate. Complex 2 inhibitor is your malonate. Complex 2 inhibitor is which one? Malonate. Carbon monoxide, C for carbon, C for cyanide, inhibits the complex number 4. Oligomycin inhibits complex number 5. Oligomycin inhibits complex number 5. So these are the complexes, complex inhibitor. Okay. Let's go to the next important aspect. What is that? That is your, what is that? Glycolysis. What is that? Glycolysis. So before going to the glycolysis, what is the space I have given here is the note for note space is because, so in till here, whatever I have told, if you need some points, you can add them here. So that is how it is planned and put the space there. Okay, but anyways, we will utilize that also, I think. Let's see. Then let's go to the next pathway called as glycolysis, or what is that? Embedded Meyerhof pathway, embedded Meyerhof pathway. So what happens here, my dear students? We have a glucose molecule which comes into the body, which consists of how many carbon atoms? 6 carbon atoms. Okay. Recently, somebody messaged me, some student messaged me and asked, sir, in those which is used in fishery, I'm not sure, but in fishery, I think they use malonate deer. Okay. Anyways, so what is that? 6 carb. This one is glycolysis. They asked me, students sent a photo and asked me, sir, should we remember the step by step and enzymes of this pathway? See, try to remember the rate limiting enzymes. As I have told in all the batches everywhere, try to remember the rate limiting enzyme. Try to remember the key points only. Don't have to remember the whole thing. Okay. Glucose is a 6 carbon containing substance which will undergo the effect of an enzyme called hexose kinase. So hexose kinase is nothing but kinase transfer the phosphate group from one molecule to another molecule. Means I have a ATP here and I have a glucose here. So ATP has how many phosphates? Three phosphates. How many phosphates? Three phosphates. Okay. So basically, I will take one phosphate from the ATP, transfer it to glucose. So glucose. So that is only called as, what is that? Glucose 6 phosphate. At a sixth carbon, I am adding the phosphate group called as glucose 6 phosphate. So I will be left with a ADP. So ATP will get converted into ADP while we are using one ATP and converting it into glucose 6 phosphate. That is with the help of an enzyme called as hexose kinase. The help of an enzyme called as hexokinase. And also it can be done by your one more enzyme, the same enzyme called as glucokinase. Okay. Hexose means 6 carbon containing sugar. Okay. So this glucose 6 phosphate under the influence of isomerase. Who is the isomer of the glucose? All of you know that it is a fructose. So glucose will get converted into fructose 6 phosphate. So to this fructose 6 phosphate, I will add one more phosphate group. So basically, I am utilizing the ATP and adding one more phosphate. It will become into fructose 1,6 bisphosphate. So if I am transferring phosphate from one molecule to another molecule, I will call it as, what is that? That is kinase enzyme. So phosphofructokinase called as PFK. What is that? PFK. Phosphofructokinase converts fructose 6 phosphate into fructose 1,6 bisphosphate. Under the influence of one more enzyme, aldolase, I will get two substances, that is dihydroxyacetone phosphate, dihydroxyacetone phosphate, acetone phosphate. Okay. So dihydroxyacetone phosphate consists of 3 carbon atoms and one phosphate group. Remember, one phosphate group. GLAP called as glyceraldehyde phosphate. Glyceraldehyde phosphate. So glyceraldehyde phosphate also consists of 3 carbon atoms and one phosphate group. Look here, totally here fructose. Fructose is a 6 carbon containing substance. So the 6 carbon containing substance and has how many phosphates? 2 phosphate groups. So 6 carbons and 2 phosphates are there. So 3 carbon 1 phosphate, 3 carbon 1 phosphate, equally we will divide them. So I will have two substances. So this dihydroxyacetone phosphate will further get converted into GLAP. So one GLAP comes directly from the fructose 1,6 phosphate. One more GLAP comes from where? DHAP. So DHAP will get converted into, we will get converted into, what is that? GLAP. So totally I will have two molecules of GLAP. So from here on further, all the reaction which is occurring twice. So that is why I have used the numbers 2 here. Use the numbers 2 here. So basically dihydroxyacetone phosphate will get converted into GLAP. One GLAP already came from the fructose. One more DHAP got converted into GLAP. Totally I will have how many? 2 GLAP. So glyceraldehyde phosphate will get converted into 1,3 bisphosphoglycerate, 1,3 bisphosphoglycerate. So during that time, it will synthesize the hydrogen. That hydrogen will be accepted by your NAD, forming NADH. So I have two GLAPs. I will get how many NADHs? Two NADH. So 1,3 bisphosphoglycerate will get converted into 3 phosphoglycerate. So this conversion takes place with the help of phosphoglycerate kinase. So their ADP will get converted into ATP. So we have taken one phosphate from the 1,3 bisphosphoglycerate and added to the ADP to form ATP. So here on further, I told all the reaction takes place twice. So totally I'll get 2 ATP. So this 3 phosphoglycerate will get converted into 2 phosphoglycerate. So within the same substance, I'm changing the carbon number of the phosphate. I will call which enzyme? Mutases. Okay, so 2 phosphoglycerate will get converted into phosphoenol pyruvate. So phosphoenol pyruvate, under the influence of pyruvate kinase, we will get what is that? Pyruvate. We will get pyruvate and 2 ATPs we will getting here. Okay, so totally, my dear students, how many ATPs we are getting? ATPs we are getting. Look and tell me, ATPs we are getting how many? Only in the form of ATP. Only in the form of ATP, how many we are getting? 1, 2, 3, 4, 5, 6, 7, 8. How many we are getting as a ATPs alone? As a ATPs alone, leave about the NADHs. Leave about the NADHs. Only ATPs. Only ATPs. Look here. 2 ATPs came here. 2 ATP came here. So totally as a ATP we got 4. As a ATP we got 4. Then we have what is that? NADH. So totally 2 NADH. 2 NADH is equal to how many? 2 NADH is equal to 5 ATP. So 5 ATP. 2 NADH is equal to 5 ATP. So totally we have got 9 ATP. So 9 ATP we have got. But the problem here is that we used 1 ATP here. We used 1 ATP here. So we need to minus the 2 ATPs which we have utilized. So we will get 7 ATP in the aerobic glycolysis. We will get 7 ATP. Very good. 9 minus 2 is 7. So net ATP is 7. You people are absolutely correct. So what is the point I'm trying to tell you? Under the conversion of glucose to pyruvate, during the conversion of glucose to pyruvate, I am getting 7 ATP. Okay. Pyruvate consists of 3 carbon atoms. So now you people should be able to understand 1 glucose is equal to 2 pyruvates. Glucose is equal to 2 pyruvate. So glucose consists of 6 carbon atom and pyruvate consists of 2 carbon atoms. Okay. So rate limiting enzyme is PFK. Phosphofructokinase is the a rate limiting enzyme. Now there is an important question which will come. Where does this cycle takes place? It takes place in the cytoplasm of almost all the cells. Cytoplasm of almost all the cells it will occur. So don't get confused whether it is in mitochondria, cytoplasm, cytoplasm. What is glycolysis? Conversion of glucose to pyruvate. Glucose to what? Pyruvate. Okay. So now I want you to understand we have an enzyme called as glucokinase. We have an enzyme called as hexokinase. Hexokinase is present in all the tissue. Glucokinase subtype is present only in the liver. So whenever you give insulin, insulin causes the increased activity of glucokinase. Increased activity of glucokinase. So when you give insulin, it increases what? Please tell me. When you increase the Yes, when you increase the quantity of insulin, automatically in the liver glycolysis will increase because the enzyme with starting the glycolysis is being induced by the insulin. So hexokinase is present in all other tissues, has no action by insulin. Remember, insulin induces the glucokinase. That enzyme is present in the liver, my dear students. Okay. So let's start off with the next important point. What is that? Pyruvate kinase deficiency. So all the important questions which have been asked here, let me teach you people. What is that? That is pyruvate kinase deficiency. So this pyruvate kinase deficiency is a type of genetic disorder which is a type of autosomal recessive disorder. Autosomal recessive disorder. So in which what happens, which enzyme is not there? Pyruvate kinase is absent. Pyruvate kinase is absent. Okay. So which is that enzyme? Pyruvate kinase enzyme is absent. Pyruvate kinase enzyme is absent. So if pyruvate kinase enzyme is absent, now you people should be able to tell me, will these 2 ATPs form? ATP बनेगा कि नहीं बनेगा? Pyruvate kinase, if it is not there, will there be formation of these 2 ATPs? ATP form आगुमा आगादा. Will the ATP बनेगा कि नहीं बनेगा? बताओ. What happens to ATP? So there is no formation of the ATP. So there is no formation of the ATP. Okay. Now the problem, my dear student, I will get to 2 ATPs here, right? And I'm using the 2 ATPs here. I'm using the 2 ATPs earlier and I'm getting the 2 ATPs here. Okay. But sir, still I can have this NADH wala ATP, right? NADH ATP I can utilize, right? No, because this pyruvate kinase deficiency occurs in the red blood cell. In the red blood cell, there is no mitochondria. There is no mitochondria in the red blood cell. It is of no use. NADH is of no use because there is no mitochondria. So in the RBC, if there is a lack of pyruvate kinase enzyme, that will lead to decreased formation of ATP from the pyruvate kinase because that enzyme itself is not there. So two ATPs are formed here and two ATPs are utilized here. So now NADH is of no use. So that will lead to zero ATP. That will lead to zero ATP in the RBC. So that is only lack of pyruvate kinase. Lack of pyruvate kinase causes the hemolytic anemia due to what? Due to lack of ATP. Lack of ATP. If there is a lack of ATP, which pump will fail, sir? Come on, quickly tell me. If there is a lack of ATP, it causes the failure of sodium potassium ATPase, which will lead to increased amount of sodium inside the cell, which will lead to pulling of more water. More water comes inside and cause the bursting or breakdown of RBC. So that is only your pyruvate kinase deficiency. Okay, then this pyruvate, whatever is there, it will get converted further into acetyl CoA. Acetyl CoA. Acetyl CoA will enter into Krebs cycle. Acetyl CoA will enter into Krebs cycle. Krebs cycle. Okay. So once acetyl CoA enters into the Krebs cycle, now the question comes to us is what is Krebs cycle? Krebs cycle is a cycle which takes place where in the cytoplasm or mitochondria. Krebs cycle takes place in mitochondria. Okay, mitochondria. Krebs cycle takes place in the mitochondria. Okay, so in the mitochondria, Krebs cycle occurs. Okay, so that is your mitochondria. Okay, let's go to the next important aspect. What is that? That is, it occurs where? In the mitochondria. Now the most important direct question which is related to your Krebs cycle, which is possibly asked, is rate limiting enzyme of the Krebs cycle. Rate limiting enzyme of the Krebs cycle is which one? Isocitrate dehydrogenase. Krebs cycle is also called as TCA cycle, tricarboxylic acid cycle, called as tricarboxylic acid cycle. Okay, so that is the story of your, what is that? That is the story of your Krebs cycle. Then let's go to the next two important diseases, that is HFI. Okay, HFI, hereditary fructose intolerance, and there is a essential fructosuria. So before going there, let me just recap. Don't write it. It is just for your recap. I'm doing this. So just quickly look at this. Quickly look at this, sir. So we have very simple as that fructose, right? Fructose, whatever is there, under the influence of an enzyme called as fructokinase. Fructokinase. Okay, under the influence of an enzyme, fructokinase, we will get, what is that? Fructose 6-phosphate. It will further get converted into fructose 1,6 bisphosphate. And this 1,6 bisphosphate, under the influence of, specifically there is an enzyme called as aldolase B. So aldolase also has types, aldolase A, B and all. So aldolase B will get convert this fructose 6-phosphate into DHAP and GLAP. What is that? GLAP. Now, all of you remember DHAP, GLAP comes where? Look here, GLAP and DHAP in the glycolysis. So from here on onwards, the reaction will take place is the same only. Reaction what takes place is same only, but till here slightly different because the reaction started from the fructose. Okay, if a fructokinase enzyme is not there, so I ate fructose containing food. So once I ate the fructose containing food, will the fructose get absorbed in my body? Yes or no? I ate a fructose containing food. Will it get absorbed in the body? Yes or no? Come on, quickly tell me. If that enzyme is not there also, will it get absorbed or not? Yes, it will get absorbed. Point to be remembered is absorption of this one will occur. What is that? Fructose will occur. But only problem is where rises about the metabolism. So fructose absorption will rise. Fructose absorption will happen. But enzyme is not there. Fructokinase enzyme itself is not there. So fructose will increase in the blood because fructose got absorbed, but it is not getting metabolized. If it is not getting metabolized, so free fructose level in the blood increases, called as essential fructosuria. Okay, so basically increase of fructose in the blood leading to fructose loss. So more fructose in the blood, more fructose will enter into the urine, leading to what is that? Essential fructoseuria. So basically deficiency of fructokinase, fructose will get absorbed and that excessive fructose will go out in the urine, called as essential fructoseuria, characterized by in the urine. If you test the urine, what you are going to find? Unmetabolized fructose in the urine. Then one more possibility is that intolerance. What is this fructose intolerance? Aldolase B is not there. Aldolase B is not there. If aldolase B is not there, so fructose 1,6 bisphosphate levels will increase. Fructose 1,6 bisphosphate level is increased, and that will lead to something called as that will, because the toxic metabolites will start to accumulate. So it will cause what is that? Intolerance for the fructose containing food. So that is only called as HFI. What is HFI? Hereditary fructose intolerance. Hereditary fructose intolerance. So it is a type of which disease? Autosomal recessive trait. Autosomal recessive trait. Mutation of which gene will be there? Aldolase B gene. Aldo B gene. What is that? Aldo B gene mutation causes what is that? Causes your hereditary fructose intolerance. So what is the enzyme which is deficient in essential fructoseuria? Everybody repeat quickly. Tell me, essential fructoseuria caused by deficiency of which enzyme? Fructokinase. Which enzyme? Fructokinase. Hereditary fructose intolerance, HFI. HFI is caused by which enzyme deficiency? Aldolase B deficiency. Aldolase B deficiency. Do not get confused between these two. Okay. All right. Let's go to the next one. What is that? Galactosemia. Galactosemia. To understand galactosemia, we need to quickly do what? We need to quickly recall the metabolism of galactose. Okay. So to recall the metabolism of galactose, let's see, sir. Quickly, let's understand. From the food, I ate galactose. Okay. Galactose came. Okay. I have an enzyme called as galactokinase. Galactokinase. This galactokinase enzyme causes formation of galactose 1 phosphate. Galactose 1 phosphate. Okay. Now what will be there, sir? We will have one more substance called as UDP glucose. UDP glucose. UDP glucose. So this UDP glucose and galactose will interact with each other with the help of an enzyme. How will they interact? First, let's understand. This galactose combines with UDP. Okay. This glucose combines with phosphate. Glucose combines with phosphate. So I will have, end goal is what? So I will have UDP galactose. UDP and galactose will get combined, and at the same time I will also have which one? Glucose 1 phosphate. Glucose 1 phosphate. So basically we are transferring UDP group from the glucose and giving it to galactose 1 phosphate. So that is why we will have the enzyme. Okay. Galactose 1 phosphate. Galactose 1 phosphate. UDP glucose, UDP glucose, uridyl, uridyl transferase, uridyl transferase. Okay, so this is what is happening. This UDP galactose further under the influence of epimerase, an enzyme called as epimerase, it will convert itself into UDP glucose further. So that galactose will get converted into UDP glucose. UDP glucose is a glucose which is required for your what is that? Secretion of your glycogen and other cycle, other uses of the glucose is there to it. Okay, so this is a story of your galactose. So automatically deficiency of this enzyme leads to deficiency of this enzyme. What is that? Enzyme galactose 1 phosphate uridyl transferase enzyme. The deficiency will lead to something called as galactosemia. Galactosemia. So it is a type of which one? Autosomal recessive disorder due to deficiency of which enzyme? Galactose 1 phosphate uridyl transferase. The clinical features of this disease are oil drop cataract, developmental delay, intellectual disability, speech difficulty, and motor defects. Okay, so what you need to remember as a direct MCQ, if they give you what is that image of the oil drop cataract and ask you this is caused by impaired metabolism of which monosaccharide? It is caused by impaired metabolism of which monosaccharide? Galactose, sorry, impairment of galactose metabolism. And that is a story of your, what is that? Story of your galactosemia. Okay, that cataract, what you're going to find is oil drop cataract. Is which one? Oil drop cataract. All right, let's go to the next one. That is your glycogen storage diseases. So glycogen storage diseases. So before going into the glycogen storage diseases, all of you should be able to recall one important point which I have told you people many times. What is that, sir? That is whenever we are looking at a person, who is having excessive intake of carbohydrate. So if there is an excessive intake of carbohydrate, that carbohydrate should be utilized, metabolized, and stored in the body. That is stored in the form of, what is that? Glycogen in the form of, what is that? Glycogen. If it is stored in the form of glycogen, so let's quickly recall the story of your, what is that, glycogen once again. So let's utilize this image and recall it. So simple as that, sir. What will be there? Whenever you have a excessive glucose, that glucose will get converted into glucose 6 phosphate. Glucose will get converted into glucose 6. This glucose 6 phosphate will get converted into glucose 1 phosphate, and it will form UDP glucose. This UDP glucose under the influence of two enzymes. One is glycogen synthase and one more is branching enzyme. It will form, what is that? Glycogen. It will form, what is that? Glycogen. This glycogen is stored in the body. We call it as, what is that cycle called as? Glycogenesis. Glycogenesis. Okay, now this is stored in the body. Whatever the glycogen which is stored in the body, what will happen? This glycogen will undergo the breakdown. Okay, glycogen will undergo the breakdown. So that breakdown, glycogen will get converted, can break down under the influence of two enzyme. One is glycogen phosphorylase, one more is a debranching enzyme. So glycogen phosphorylase will convert the glycogen into glucose 1 phosphate. Okay, and that is having a effect by two enzyme. One is glycogen phosphorylase and one more is branching enzyme. Now I know that this one sounds, though it is easy for you people, I don't want to leave it out for chances, especially not formation of glycogen. The breakdown of glycogen is a very important concept for you people. Now glycogen, sir. Glycogen, whatever is there, it undergoes the effect of one enzyme called as glycogen phosphorylase. Okay, so glycogen phosphorylase, which breaks which bond? Alpha bond. Which bond? 1,4 bond. 1,4 bond. Okay, that is in a straight line. Okay, so that will give rise to glucose 1 phosphate and also something called as limited dextrine. What is that? Limited dextrine, which is also a simpler as that called as glycogen. Okay, sir, you broken glycogen, and how did you get glycogen? This is the point where you should not get. Glycogen is made out of hundreds of glucose. Let's imagine 100 glucose is there. 100 glucose combined together to form a glycogen. Now in that I separated only one glucose. 99 glucose together is called a glycogen only. Then I separate one more, 98 glycogen only, 97 glycogen. After breaking each glucose, I will call it as limited dextrine. This limited dextrine can undergo the influence of one enzyme called as debranching enzyme. Which enzyme? Debranching enzyme. Again, I will get a glucose 1 phosphate and limited dextrine. So this process will continue till it forms, what is that? Multiple glucose 1 phosphate. This glucose 1 phosphate will get converted into glucose 6 phosphate, and glucose 6 phosphate, it will lead to formation of glucose with the help of glucose 6 phosphatase. Okay, so I hope all of you remember this. याद आ रहा है कि नहीं आ रहा है? नया नया तो नहीं लग रहा है ना? You don't feel it as new thing, right? Able to recall? Dr. Glucagon, thank you. That means a lot to me. So that is only your, what is that? That is your glucose 6 phosphatase. So that is leading to formation of your glucose. Now, if there is a deficiency of the enzyme, definitely we will have glycogen storage disorder. So we have type 1 glycogen storage disorder. I will be telling the type 1 and I'll be repeating. वहां पे बैठ के repeat करना. You should repeat with me. Okay. One Girex disease is due to deficiency of glucose 6 phosphatase enzyme. Glucose 6 phosphatase enzyme. The patient will have hepatomegaly and repeated episodes of hypoglycemia. अब बच्चे बहुत ब्रिलियंट होने लग गए. क्या कर देते हैं? Sir, if hepatomegaly comes, I will mark one Guyker's disease. No, you should not mark that, because hepatomegaly can be found in Cory's also possible, Anderson also possible. Hepatomegaly can be found in parasitic diseases also. Hepatosplenomegaly can be found. So you cannot differentiate based upon the symptom, because generally all the storage disorder can have organomegaly. Organomegaly is possible with all the types of storage disorder. So glucose 6 phosphatase deficiency is called as type 1 glycogen storage disorder. It is also called as von Girex disorder. Type 2 Type 2 is due to deficiency of an enzyme called as acid maltase. Sir, what is this acid maltase thing? Now, whatever glycogen is there, right? Glycogen enters the lysosome. In the lysosome, glycogen is broken down by acid maltase. If acid maltase is not there, so what will happen? Inside the lysosome, who will get stored? Glycogen will get stored in the lysosome. So that is only your Pompey's disease, due to deficiency of which enzyme? Acid maltase. Deficiency of which enzyme? Acid maltase. We can have patients, we can have this, have these patients with the symptoms of muscle related, mainly. What is that? Muscle weakness, then cardiomegaly, hypotonia, cardiomyopathy are possible. Pompey's disease mainly affect the muscle. Okay, so mainly affect the muscles. Okay, then Cory's disease. Cory's disease is due to debranching enzyme deficiency. Anderson is due to deficiency of the branching enzyme. As I have taught you people, A, B, C, D. A for Anderson, A for Anderson, B for branching deficiency, C for Cory's, D for debranching enzyme deficiency. Remember, with the mnemonic, these two disorder: A, B, C, D. A for Anderson, B for branching enzyme, C for Cory's, D for debranching enzyme deficiency. Then we have type 5, that is your McArdle's disease, that is due to glycogen phosphorylase. Which glycogen phosphorylase? M for McArdle, M for muscular glycogen phosphorylase deficiency. Then we have one more thing, Hirsch disease. Hirsch disease is due to glycogen phosphorylase deficiency, that is hepatic glycogen phosphorylase deficiency. So hepatic glycogen phosphorylase deficiency leads to Hirsch disease. Okay, PFK deficiency is called as Tarui's disease, but I want you to remember mainly at least 6 of them. All these are previously asked questions, so you need to remember this. Okay, now the questions will come like this. I'll give you one question. I want you to solve it. Okay. पॉम्पेस में 1,4 का भी दिक्कत नहीं है, ना ही 1,6 का. Inside the lysosome, digestion of the glycogen that will occur with the help of acid maltase, which can actually affect both of them, 1,4 and 6, both of them possibly. Now, a child with recurrent episodes of what? Episodes of hypoglycemia. Okay. Then also hepatomegaly. Found to have glycogen storage disorder. Okay. So deficiency कौन सी होगी? Deficiency होगा इसके अंदर. एक सेकंड क्वेश्चन कंप्लीट करता हूँ. एक सेकंड क्वेश्चन कंप्लीट करके आई विल एक्सप्लेन यू. रश मत करो, डोंट रश. Doctor, I'll explain, just 1 second. Let me complete the question first. Glycogen storage disorder. On the biopsy, found to have. यही तो अभी क्वेश्चन खत्म नहीं हुआ सर जी. Found to have excessive deposition of branched, branched limited dextrins, branched limited dextrins, due to deficiency of which of the following? Deficiency of which of the following? Option A, Van Geeker's disorder, Van Geeker's disorder. Option B, Pompey's disorder, Pompey's disorder. Option C, Anderson disease, Anderson disease. Option D, Cory's disease. अब बताओ आंसर, एंडरसन और कोरिस? एंडरसन, एंडरसन है क्या वो? अरे श्योर? यस, वेरी गुड, दैट आंसर इज करेक्ट. तो यहाँ पे देखो सर, यहाँ पे देखो एंडरसन है क्या वो? दैट इज नॉट एंडरसन सर. दे हैव एक्सेसिव अमाउंट ऑफ ब्रांच्ड लिमिट डेक्स्ट्रिन. अरे ब्रांच्ड लिमिट डेक्स्ट्रिन है, ब्रांच्ड लिमिट डेक्स्ट्रिन इज नॉट ब्रेकिंग. सो which enzyme is not there? Debranching enzyme is not there. So if there is no debranching enzyme, if there is no debranching enzyme, automatically what will get deposited in the body? In the body what will get deposited? Branched limit dextrin. That is not Anderson, that is your Cory's. मजा आया? कैसा लगा मेरा मजाक? सो दैट्स व्हाट आई एम टेलिंग यू. ध्यान से सुनो, ओके, ध्यान से सुनो, प्लीज अंडरस्टैंड. ब्रांच्ड लिमिट डेक्स्ट्रिन इज देयर. सो व्हाट इज डेपोजिटेड? ब्रांच्ड वन इज एक्सेसिवली डेपोजिटेड. इफ एक्सेसिवली डेपोजिटेड, कौन सी एंजाइम नहीं है? व्हिच एंजाइम इज नॉट देयर? बिकॉज़ डीब्रांचिंग इज नॉट देयर, इसलिए ब्रांच्ड वाला अक्यूमुलेट हुआ. So debranching enzyme deficiency will lead to accumulation of what is that? Branched limit dextrin. So answer is Cory's. ओके, सो डोंट गेट कंफ्यूज्ड. इसीलिए भैया क्वेश्चन को ध्यान से पढ़ना है. वहां पे डिपॉजिट क्या हुआ है, व्हाट इज बीइंग डिपॉजिट, என்ன டெபாசிட் ஆயிருக்குதுன்னு பாருங்க. look at the what is deposited there. So based on that you need to answer. Okay, so it is not Anderson, it is Cory's. Okay, चलो कंटिन्यू करते हैं. Let's continue. That is your hepatic glycogen storage disorders. So okay, now once we understood about that, let's talk about one more important aspect, that is your G6PD deficiency. So if we do the G6PD deficiency, all the important aspects surrounding the carbohydrate has been revised. Okay, G6PD deficiency, अगर G6PD का याद नहीं होता है तो चलिए थोड़ा याद करवा देते हैं. Let me make you people recall. Okay, चलो सर. G6PD deficiency. What happens in G6PD deficiency? So first, to understand G6PD deficiency, we have a HMP pathway. In the HMP pathway, we have an enzyme glucose 6-phosphate dehydrogenase. This glucose 6-phosphate dehydrogenase produce somebody called as NADPH. Produce somebody called as NADPH. Okay. Now we have something called as glutathione. We have something called as glutathione. What is that? Glutathione. This glutathione, my dear students, undergoes something called as which reaction? Peroxidation reaction. Glutathione undergoes peroxidation reaction. Okay, so glutathione undergoes peroxidation reaction. So while it is undergoing the peroxidation reaction, it will convert H2O2, that is hydrogen peroxide, which is a source for your free radical, will get converted into H2O. So glutathione undergoes peroxidation. So glutathione undergone, what is that? Undergone oxidized form. Okay, now this oxidized glutathione will come back to glutathione in a form called as reduced glutathione. Okay, so this requires what is that? NADPH. If NADPH is required coming from G6PD, NADPH is required, whatever NADPH is required coming from G6PD. Okay, so let's start. If I don't have G6PD, automatically no NADPH. If there is no NADPH, glutathione reduced will not be formed. So glutathione will not undergo peroxidation. If no peroxidation, H2O2 will become more in the red blood cell. If H2O2 becomes more in the red blood cell, H2O2 is what? Free radical. Free radical is any substance. Free radical is like what? Free radical is like a substance which can interact with anybody. Free radical is a substance which can interact with anybody. So automatically G6PD deficiency leads to decrease of NADPH, 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 because of which there is an increase of H2O2 in the RBC. If there is an increase of H2O2 in the RBC, H2O2 is a free radical. Free radical किसी के साथ भी जाके बात करेंगे, किसी का भी it can go and ask react with anybody. It's like the person who can go and ask for the number to any, like anybody's phone number, like that only. This G6PD deficiency, we have a excessive H2O2, it will have a free electron. That free electron will interact with the cell membrane of the RBC. So once it reacts with the cell membrane of the RBC, we will get Heinz bodies. We will get Heinz bodies, and these Heinz bodies will be further removed by your splenic macrophages, creating your bite cell. So in the peripheral smear, you are going to find bite cell and Heinz body. So whenever G6PD deficiency is there, the child is healthy. The child is healthy. Any condition where there is an increase of free radical, the child will have hemolytic jaundice. Hemolytic jaundice means there is an excessive breakdown of RBC will occur whenever there is an increase of free radical. Whenever there is an increase of free radical, when will free radicals be increased? So what are the factors which will precipitate the G6PD? The factors which precipitate the G6PD is old anti-malarial drugs, old anti-malarial drugs. Okay, if any inflammatory condition, sulfur containing drug, aspirin and fava beans. So these are the fava bean injection. These are the condition where patient will become symptomatic with the G6PD deficiency. The child will have a symptom of hemolytic anemia. So what is the gold standard investigation? That is your G6PD assay. तुम लोगों को question होगा. So we have a question. What is that question is? So how do we treat it? So we just have to avoid the triggers. Avoid the triggers. So keep the precipitating factors away. The child can have a healthy life. So that is the gold standard. They'll ask you. We are going to check for G6PD assay. Don't make the answer as Heinz body. If they ask you gold standard, we are going to check for the G6PD levels itself, sir. Okay. So that is the story of your G6PD deficiency and carbohydrate. All the important key points have been discussed. Okay. So with this much being said, let's take one break, dear students. We have finished the carbohydrates. Then we'll start the amino acid. So let's start at the class. Now what is the time? 4:42. Okay. Let's start by 5:10. Okay. Break till 5.